So good morning, good afternoon, and good evening, everyone. Thank you all for joining us today for this important event. My name is Colleen Rapnoe, and I'm the PSEA manager at the CHS Alliance, and I will have the pleasure today to moderate and to facilitate this one-hour webinar. So before we start, I just would like to remind you that this event offers simultaneous interpretation in French, in Spanish, and in Arabic. So please check the chat for further instructions, but you will be able to use it by clicking on the interpretation button and selecting your preferred language. So if you have also any questions during this one-hour webinar, please do not hesitate to use the chat, and we will do our best to respond to your questions. So we are here today to present and discuss the findings of our latest analytical report from the Harmonized Reporting Scheme on sexual exploitation, abuse, and harassment, which is a system to report comparable data on SEAH for the analysis of trends and patterns. So this session will be an opportunity to delve into the findings of our report, to understand their implications, and to discuss practical strategies to use them to enhance our efforts in preventing, but also in responding to SEAH. So before we begin, I just would like to extend a warm welcome to our distinguished speakers who have joined us today. So you see most of them on the screen. So we are grateful to have with us Mathilde Bailey, the Harmonized Reporting Scheme project lead at the CHS Alliance, who has been leading this project in partnership with the Standing Committee for Humanitarian Response since 2021. We have Tanya Wood, our CHS Executive Director. We have Peter Taylor, the head of the Safeguarding Unit at the UK Foreign, Commonwealth and Development Office, more famous is FCDO, and who has been instrumental with his team in supporting this initiative from its very beginning. We have also Andrea Watkins, the Technical Director at the Resource and Support Hub, RSH, which is a leading resource network on SEAH for civil society organizations. Then we have Abida Peters, the Safeguarding Manager at Niras, representing the private sector commitment to this cause. And last but not least, we will have Marta Agosti, who is the PSEA Network Coordinator for Palestine and who plays a key role in coordinating PSEA efforts of all organizations on the ground. So, without further ado, I will pass on the floor to Tanya Woods for some opening remarks. Tanya, the floor is yours.
Thanks so much, Colleen, and a huge thank you to everyone who's on the call right now. I think we're all aware that it's a very busy time, so I think making the time out to join us today is a kind of testament to how much we need to kind of join together in the continuing fight of sexual exploitation and abuse across our organisations, but also with the sector at large. So the CHS Alliance is a network of organisations from across the globe that have joined together to demand greater accountability in our work. But to be accountable, you need the transparency. The two go hand in hand. You've got to have the transparency to be accountable. And that's why this scheme is so critical and adding to the work of the Alliance as a broader network to get the transparency and the evidence of what is really occurring around the sexual exploitation, abuse and harassment in the sector, because we need this understanding, we need this evidence, we need this transparency if we're really going to be able to tackle it and the challenges that lie behind it. The CHS Alliance, as we've all got these nice little, got to move which way to work, we've got these nice little logos behind us, which I think give testament to the fact that the Alliance is driven by a strong belief that no organisation alone can tackle these issues, but that we really need to work collectively. We've got to put aside our own individual nervousness or rationale for why we wouldn't join with this scheme, and believe that we have to do this as a collective mission. So an enormous amount of respect and credit needs to go to the now 70 organisations that have joined the scheme. And I think really because the scheme hasn't been going for that long, so to be able to kind of pioneer and go and start and be part of something new in tackling this, I really want to give credit to those organisations who recognise that this does play an important role. And of course, today is to encourage those of you who may not have joined the scheme yet, but encourage you to come on board with it. This collective approach is something that I know the next speaker, who I'm going to introduce to you, Peter Taylor, as Colleen said, the head of the safeguarding unit at FCDO, we know has championed. Many of us, including the Alliance, but also many of you who I see on the call, the names on the call, joined together recently over the last year to look at what this common approach to PSEAH would take. And it's been fantastic to be part of that movement that has created what's known as the common approach to PSEAH, but that many of you will know as SEAH. So with that sort of recognition, it's great to have you with us, Peter. Thank you, as Colleen said, for the support that you've given to this, but also as well in terms of pushing for what's needed to do on the collective. So with that, I'll hand straight over to you. Thanks, Peter.
Great. Thank you very much, Tanya, and thank you, Colleen and Mathilde and everyone else involved for the fantastic work on this initiative. It's come so far in the last few years, but it feels like it's only just beginning, and I say that in the nicest possible way because of the possibilities it really presents, which are so important for the reasons you've said. So from a UK perspective, and I'm pretty sure I speak for most other donors, we support decisive actions to try and increase data transparency and analysis. We talk about a zero tolerance policy to SEAH. This has never been about having zero cases. It's about zero inaction when it comes to all organisations and individuals doing all they can reasonably do when it comes to prevention and response. And that includes work related to data. So we want everyone to do all they reasonably can to prevent and respond to SEAH. So we really, as the UK, speaking as the FCDO in the UK, we really encourage all partners to join the Harmonised Reporting Scheme and to encourage others in your networks to do the same. As the FCDO, we have aligned our reporting requirements to the HRS because the data fields in the HRS provide us, in the first instance anyway, with the information that we would be requesting anyway from an organisation or an individual reporting an incident. And then in the event of an investigation, if that report turns into an investigation, we will continue to require some additional information. There's real power in data analysis, and this is why the scheme is so important. And I think you'll hear more from Mathilde about how this works in practice shortly. But this is about helping us all better understand the challenges that we face and how to take practical action, as has been mentioned already. So let's take a couple of examples from the recent analytical reports that we're going to talk about a bit more. So 1 victim out of 3 is a girl under 18. So we in FCDO can use that data to drill down on the child safeguarding needs in conversation with our key partners and our staff. A second data point is the fact that 51% of victims report to NGO staff. So they report the incident to an NGO staff member. So this underlines both the continued need to ensure everyone who works for organisations is trained on how to handle a complaint, and also shows that partners need to continue working on having accessible reporting mechanisms. The HRS, as has already been mentioned, is also fundamentally about accountability. Information is made public on actions taken, and this could incentivize others to come forward in a situation where we know underreporting is chronic and widespread, and there is a marked lack of trust from affected individuals in the systems that currently exist. So the more that we can demonstrate that reporting leads to carefully thought through action, the more organisational cultures will increase accountability to affected populations. It's really great to see the United Nations so directly involved and supporting this project. And I hope that much closer alignment with the UN's iReport system will be possible in the next year, as I know is the plan. And finally, for any other donors on the call or listening to this later, if you're watching the recording, I would really encourage you to consider joining or at least promoting the scheme and aligning with it. We've heard as donors time and time again over many years how greater donor alignment on approaches to PSEAH can help drive change and reduce burdens and save time and money and help keep people safer. This is one such really concrete example. Thanks very much.
Thank you, Peter, and thank you, Tanya, for this opening remark, always very relevant, and for flagging the importance of this initiative. Now, I would like to go to the heart of the matter and give the floor to Mathilde Belli, who will present the key finding of the last biannual report and give example of how these trends can be used to better reduce the risk of SEAH, better prevent, and better response. Mathilde, the floor is yours, and I'm going to share my screen. Hopefully, I will manage.
Thank you so much, Colleen. It's great to see so many people here. So as Colleen says, as she shares her screen, great, perfect. Thank you, Colleen. I think we can't see your full screen. If you can, I think we can see your notes. All right. Well, as Colleen manages her screen share, I wanted to say that what I'm going to present now is only a very, very small snapshot of some of the kind of top line global trends that we have in our report. So I really encourage you to read the report, which we're going to share in the chat, which goes much more in depth, crosses different data sets, has recommendations. So really encourage you to get into reading that report. So this is just going to be a very small snapshot. So as you can see on the screen, our data highlighted that 3 in 5 incidents reported, so 61%, were sexual exploitation. Abuse amounted to 34% and harassment to 27%. And the reason the total is not 100 is that some incidents included multiple types of misconduct. And so to give you an example, what can we do with this information in practice? So the predominance of exploitation really shows us the importance of focusing on prevention efforts, looking into power imbalances between staff, between aid recipients, which we know are really central to exploitation. So in practice, it could be, including real life scenarios in our SEAH trainings to show how subtle power imbalances can lead to exploitation and how staff can recognize those so that they can mitigate them in their daily work. Or it can be directly explaining to community members during community awareness sessions what constitute exploitation. Talk about these power imbalances, because they may not always understand that these unequal relationships constitute exploitation, and that of course aid workers are not allowed to abuse of their power, and that they have the right to report it. So these are just some examples. And then when it comes to who are the victim survivors, so we saw that the vast majority were female, so 93%. And as Peter said, quite alarmingly, we had 1 in 3 victim survivors who were girls under 18 when we look at all incidents together. And then when we look specifically per type of incidents, we see that girls are at high risk of sexual abuse. So 1 in 2 girls, 1 in 2 victim survivors of sexual abuse were girls under 18. So this, of course, shows the vulnerability of this specific groups, especially in contexts where they rely heavily on aid. And it really emphasizes the need for child safeguarding measures as a key priority in the sector. So how can we take a child protection lens when we look at safeguarding? For instance, it can be setting up child-friendly reporting mechanisms, training staff on child safeguarding, making sure that codes of conduct have specific clauses on safeguarding children, and of course, informing children and their families about their rights and what constitutes this abuse. Next slide, please. When it comes to how are people reporting? Peter touched on this, but we keep seeing really high levels of disclosures. So in half of the incidents, to staff members directly. And we see that community-based complaints mechanisms are being underused. So only in 11% of reports, only 11% came through CBCMs, which could indicate that people don't know about these mechanisms, or that they don't trust them, or maybe that they're simply inaccessible. So 2 action points for us here based on this trend. First, we must invest in staff training. We saw that in our previous report, particularly for frontline staff. They need to know how to report sensitively, safely, and efficiently to a disclosure that could be done to anyone. And this is really key if we want to make sure that we take a victim survivor centered approach, but also, of course, to make sure that incidents are being investigated. Because if entry points, whoever they are, do not collect the correct information, we risk never being able to contact the victim survivor to take the case forward. And of course, if they don't report in a sensitive manner, we risk the survivor never wanting to talk to us again, which will discourage others from reporting. So this is a big lesson from this report and the previous report to ensure that everybody understands reporting mechanisms within the organization, how to accompany victim survivors to these mechanisms, because that person, that survivor in whatever country will not know who your PSEAH focal point is in the organization. They will not know your reporting system. They will just choose the individual they trust most, and which very often is going to be the person that they see most, so that frontline staff. So that's really one important action. And second, we need to understand why these CBCMs are being really underused. And the answer here is going to be super context specific. We need to consult communities. We need to ask them how they would feel most comfortable and most safe in reporting. Now you can see our maps to the right, so the geography of the incidents. Obviously, they're pretty small on our screens because they're world maps, but you can see them much bigger in the report. And what we saw was that most reports came from DRC and Syria, but that information is not necessarily what's most useful to us in terms of geography, because we know that we have a high operational presence of HRS participants in those countries. So basically, it means also that reporting mechanisms are working in those countries. So you can see that we have a blue map, which is where incidents are being reported. And so the darker the color shade, the higher the number of reported incidents. And then we have a pink map that shows you where organizations reporting into the HRS work. So same thing, the darker the color shade, the more participant organizations. And so we can see that DRC and Syria, we have quite a presence. So it makes sense that we have quite a lot of incidents reporting. However, what's interesting to look at is countries where we do have a high presence of HRS members and participants, but where we have low reporting numbers. So that could definitely indicate that we have an issue with underreporting. So that's really how we're using this information on geography, not only saying, hey, that's where we have most incidents, that's where we have the problem. Also where we have high operational presence and the little reporting means that we have an issue. So here we have the example of Ukraine, Colombia, Mali, and Pakistan, where we know that we have high operational presence and low reporting, which again could indicate underreporting. So what can we do in those countries? First and foremost, consult communities. Ask them, do they know, obviously, about SEAH? Have we done awareness raising? Do they know how to report? Do they trust the reporting mechanisms? Are those safe? Are those accessible? And then take action based on, what we've been told. Increase awareness raising in those countries. Make sure people know their rights to report, and make adjustments to the reporting mechanisms, whatever those may be, in whatever the most relevant ones may be in your context, and make sure that these mechanisms are trusted, safe, and accessible. Next slide, please. So when we look at, who reported, who were the perpetrators of the incidents, we know it. Managers have a significant amount of power in the aid system and everywhere. And so we see that 15% of alleged perpetrators are in managerial positions. So what does that mean? Of course, they can abuse of that power. And because they're in that position of power, it means that people are going to be even less inclined to report and more afraid to report. So we can safely consider that percentage is probably much higher due to underreporting for this specific profile. Another profile of perpetrator where we see high risk are, what we call affiliated personnel. So 18% of incidents. Those are people like volunteers, contractors, incentive workers, partner staff, who don't have a staff contract per se with our organization, so they don't always sign a code of conduct, which is what we've seen. But effectively, they work on behalf of our organization. And remember that in the eyes of people from the community, they do not care if they are your staff, your contractor, if they sign a code of conduct, whatever their contractual status may be. For them, they work for your organization. And then finally, in 19% of incidents, we had no alleged perpetrator that was identified. So again, goes back to the fear of reporting, but also the fact that some staff may not be trained in collecting the right information on the incident. And we saw that a lot in the last report, where in many incidents, we had insufficient information to assess the allegation. So what can we do with this information? Again, how is this data useful? First off, we must make sure that managers and leaders are accountable when it comes to SEAH. And that's not just in theory. PSEAH must be a standard part of everybody's objectives, performance evaluations. So we really provide detailed tips when you look into the report on this section. And it's really crucial, again, here that organizational cultures change. If they don't, SEAH will continue to be perpetrated. So that's a really important learning point for us. And then it's really imperative that we strengthen our vetting and training procedures for affiliated personnel. So vetting processes must have a strict section on PSEAH. These affiliated personnel must sign the code of conduct, and that was a learning that was shared by a lot of members. They realized when they saw this data that they needed to revise their processes. And all affiliated personnel who will be in contact with crisis-affected communities must be trained. That should be really a non-negotiable. And when we say training, it's not just have one sentence on the definitions, but really have scenarios so that they understand what is the expected behavior. And so, yeah, as I said, they're not our staff, but we must monitor their behavior as well, because if they commit sexual exploitation, abuse, or harassment, at the end of the day, it is our responsibility, and it will damage our trust in the community. So this is something that's really coming out strong in this report. And then in the pink box, you can see response. What are we doing in response to these incidents? So we saw that only 16% of staff were dismissed, 15% were sanctioned. In 22% of incidents, no responsive action was possible. And that's something that's similar to the last report, where it's actually even higher. And we're seeing that when we ask participant organizations why, the most common challenge shared is working with affiliated personnel, again, where they were not able to take action because they didn't have the processes in place when they were working with a partner or a contractor to be able to make them accountable for SEAH. So that was a really interesting finding. And then again, organizations, we see that organizations really need to improve their internal accountability mechanisms and case documentation and follow-up systems, and that we must, for the donors in the room, we must allocate funding to support this entire process, from staff training, the frontline staff that I mentioned just earlier, so those people who are receiving the disclosure, to training the investigators, so that we can ensure that accountability and that justice. Next slide, please. And then finally, last but not least, what are we doing to support the victim survivors? So here, figures show that a significant proportion of victim survivors either cannot access assistance or did not seek it. So this indicates gaps in availability, awareness, or just trust in the system. And the 31% who did not seek assistance, it may reflect, it's not just that they said, oh yeah, I don't want assistance. It may also be that they fear retaliation, stigma, or that they haven't been told about what were the services that were available. So what does that mean for us? Obviously, we must create safe, trusted, and accessible pathways for victim survivors to get the help that they need. Really important for us to collaborate with the gender-based violence and child protection actors on the ground. They already did a big part of the work in most contexts, and usually have those referral pathways mapped out. So every single organization must already know what assistance is available and who provides it where before any incidents come up. We don't want to be running around whenever an incident comes up. So really going back to that frontline staff, who will probably be the one who receives that disclosure, they need to know how to share information on the services available. And yes, it's not realistic for every single aid worker to know about the referral pathways, but at the very least, they must know who they can call to ask, this person needs information on services, what can I share with them? So really having that system in place. Really ensuring access to support for victim survivors is non-negotiable. That's one of the most critical ways for us to combat underreporting. Why would I encourage my neighbor, my friend, my sister to report an incident if last time nobody did anything to support me? So that's something that really came out strongly. So I'm going to stop here for the trends and really encourage you again to read the full report. We go much more in detail in the trends. There's like snapshot for countries where we have most reporting, and you'll see it's really interesting because when we look at trends in the DRC and Syria, which are where we had most incidents, they're actually very different. So really important here to, this global data is really useful, but it's even more useful to look into that country data because, again, a lot of it is so contextual. So yeah, we really encourage you to read the report. And now what I will do is share my screen to give you a very quick demo, a very quick insight into what the HRS platform looks like. So you can see here, it's a very simple platform where you can add your incidents, view your incidents, and I'm not going to show you how to actually go into that. Reporting an incident is extremely simple, really takes you 1 minute, and we're really happy to show that at another moment. But what I wanted to focus on is show you this trends page, which our members have access to. You will see absolutely no confidential data, and the incidents that the trends I'm going to show you for the organization are purely fictional. So on this trends page, you can see here that you have 6 tabs, one for the geography of incidents, one for general information, that's the type of allegation, etc., one for the reporting channels, one for victim survivors, one for alleged perpetrators, and one for the response taken. So I'm going to give you, so obviously you have fancy maps, fancy graphs. I'm going to take the example here of the reporting channels because I think that's one that's quite easy to understand. And you can see here that for all of the members, and maybe I'll take a tiny step back and say that each member, each participant organization into the HRS has their organizational space. So when I click view SEAH incidents, I am seeing the incidents only of my organization. So no worry there, you're not going to see the incidents of everybody. But for the trends, you can see your organizational trends. So here you can see, if you want to know which reporting channel people are using to report into my organization, I can have my maps here that are automatically generated. And then if I want to see, what is the profile of the person who's reporting, I have that as well. Or if I want to look at how are victim survivors reporting when they are the one that are reporting, which, what are they using? So here, for example, they're reporting to a staff from my organization in most cases. And then what's great is that here again, these are my organizational trends. So for only the incidents that I've reported. And then here you can see the aggregated trends. So this is, the real power of this platform is, of course, it's going to make your life easier because you'll have your organizational trends, but you can really benchmark yourself against the rest of the sector. So you can see in a really safe way the data from other organizations that are fully aggregated. So again, no way of knowing which organization reported what. Obviously, we don't have any kind of identifiable information on victim survivors. And so you can really compare those two and see where your organization stands with the rest of the sector. And then you have filters, which automatically update the graphs below. So for example, if I want to look only at incidents of sexual exploitation, I can filter. If I want to look at how are minors reporting, I can use that filter. Or if I want to distinguish between, is the survivor a member of the community or a member of staff? And of course, if I want to look at the specific country of the incident. And a caveat here in the country is to say, for your organizational trend, you can filter for any kind of countries because obviously those incidents. However, for the global trend, we only activate filters when we have a specific threshold of incidents into the platform, obviously to make sure that there's not any kind of risk of identification. And then obviously you can filter for a date if you want to look at a specific period. So again, this is really meant to be a tool that's really useful for your organization. So to stop you from having to do all of that manual data analysis and to be able to benchmark yourself and learn from the rest of the sector. So I'm going to stop here and pass back to Colleen so that we can move on to the panel and have a lot of other great ideas of how we can use this data to learn. Back to you, Colleen.
Thank you, Mathilde. Thank you for this great presentation about the Harmonization Reporting Scheme and how powerful it can be to have data and trends on real time. So now I would like to hear from our speakers. So we'll start with Andrea from RSH, why it's so important for civil societies organization to join the Harmonization Reporting Scheme, Andrea, and how can the civil societies leverage the finding of this report to strengthen their internal SEAH policies, but also practices. So Andrea, the floor is yours. You are already on video and you have 5 minutes. Thank you, Andrea.
Excellent. Thank you so much, Colleen. And thank you to the RSH team for this amazing piece of work and for working so hard to communicate some often very complex information in very clear and simple, easy ways that we can digest and we can understand and start to interrogate. I think the value add for civil society organizations is immense. It will take me over 5 minutes to go through all of the things I've been thinking about in preparation for this webinar. But I think I will say, in terms of obviously what we've been discussing today, the more organizations that sign up to this, that start reporting, it just gives us more descriptive data to be able to do something with, to be able to take in the field and activate and really become more evidence informed in our approaches. And I think for civil society organizations, and that's who we work with primarily on RSH, it's even more important that this is not just a scheme or initiative for large INGOs. Of course, you welcome participation from organizations of all types, but sometimes civil society actors, particularly very small ones, oftentimes feel that these initiatives don't apply to them, aren't really aligned to their needs. And I think from understanding the platform and going in there myself and attending meetings, and the feedback that we've had has just really emphasized how easy it is, how quick, how fast. If you don't have a lot of HR capacity or safeguarding or SEAH internal capacity, you can still go into the system and start to engage with it, interact with it, and report. So I think that's one thing. It's ease of use, it's very intuitive, and it's very user-friendly. I think the other thing that we hear about on RSH is there's a lot of different types of requirements for reporting across different donors. And I think Peter alluded to that at the top of the call. We hear that a lot. And I think the fact that FCDO and other donors are increasingly start to align their data that they're requesting with the RHS is just really, really helpful. It reduces the admin burden for small civil society organizations. And it really, I think the fact that they get something out. So when you go in, as Mathilde has been showing us, when you start to input the data, you get something back as an organization. You can get to see your numbers. You get to see some trend data. And for many civil society organizations, they're at different journeys of their data capture. Some of them have these systems in place. Some of them are more emerging, and some have very little in place. So this is an amazing platform for them to start to get information out of it, which they can use to then build safer programming, interrogate the kinds of delivery they're doing, how to think about how to do it more safely, how to do it in a more contextual way. I was also struck by the figure that CBCMs are only used in 11% of reported cases. So then as a small organization, you can start to unpack that and ask why. As you've talked about, Mathilde, thinking through more than just we have a CBCM, is it relevant, is it accessible, is it trusted, and using this data to become more evidence informed and to really think about what we're doing and making sure our approaches are contextual and responsive. So I think there's more I could say, but I think it does underpin, I think Tanya mentioned it, the accountability, the transparency, for small civil society organizations who are juggling so much. They are doing amazing work. They don't have big budgets. They have lots of dedicated people, but not enough manpower at times. These systems and what the HRS means, how it can be used is really, really impactful. And I look forward to having more CSOs joining and then having much more of a richer data to be able to meet again in 6 months' time or meet again in a year, and then look at the progress that's been made. So I'll stop there, but thank you very much.
Fantastic, Andrea. Thank you very much for flagging all these points about the easiness, the intuitivity, and the fact that data also, we provide something, we get something. So thank you very much for flagging that for the civil society organizations. And thank you for saying everything in 5 minutes, which is a challenge also. Now I would like to give the floor to Abida from Niras. So Abida represents the private sector organization. So Abida, how can joining the HRS, the Harmonized Reporting Scheme, be a first step towards making private sector actors more accountable to SEAH? And why do you think these findings that Mathilde just highlights are relevant to their work? Thank you, Abida.
Thank you. Thank you for inviting me today, Colleen and Mathilde. And Andrea, I really appreciate how you've highlighted the importance of CSOs to join, because I think that they really could enlighten us on why we're not getting the reports from the CBCMs. So really hope that more CSOs join to give us that insight. And I'm looking forward to hearing from Marta too. The figures released in the latest report really highlight the ongoing need for all of us to work together to tackle SEAH. Those of us who work in safeguarding, we know that the incidences are happening. Like Peter said, it's not a zero tolerance policy. That doesn't mean that we don't expect it to happen. It just means that we have a zero tolerance for inaction. And we know that these reports are seriously underreported. And as a wider community of safeguarding practitioners, we've all been saying this for years. Now, whether we like it or not, our work depends on data as a driving factor for change. And gathering data through the HRS is a vital exercise in understanding the violations that are happening to boys, girls, men, and women around the world. Now, the private sector can no longer stand by as a silent observer. We have to stand up and we have to become part of the solution. And contributing to data is just a small part of working across sectors to hold all perpetrators of abuse accountable. Now, for me, as someone working in the private sector, one of the hardest statistics shared in the report highlighted that contractors specifically were the most common alleged perpetrators in incidents against girls under 18. Mathilde touched on that a little bit earlier. And it's a statistic that should horrify everyone working with contractors. And for too long, I think the private sector has just done the bare minimum to ensure compliance and due diligence on safeguarding a PSEAH. So for me, I think that joining the HRS is just a small step that the private sector companies can do in order to highlight a commitment to end SEAH in the aid sector. So joining the HRS can send a strong and clear signal to our clients, to our partners, and to the public that we are also committed to ending SEAH and that we will take action to prevent SEAH within our work. So the heavy reliance that we have on consultants and independent contractors comes with a clear risk to vulnerable people, particularly young girls. These figures show the importance of appropriate vetting of external staff. So like Mathilde said, if you read the report, recommendation 4 to improve vetting and training for contractors is one that I plan to personally take forward in my own company and should be a clear priority for all of us. I hope this report helps companies in the private sector to renew a commitment to stamp out SEAH in their operations. And of course, joining the HRS is not the only option open to private sectors. It's the first step. We also have the Safeguarding Leads Network, so you can join forces with other safeguarding leads across the private sector to educate yourself and improve standards working together. So we can't shy away from joining and sharing our own findings of SEAH violations now that we know the risk that we personally as the private sector pose to communities around the world. I recently read a piece of research from Dr. Mayumi Fuchi on accountability in the aid sector, and she quotes an aid worker who was based in Sudan, and he said, this is such a taboo topic and nobody wants to talk about it, but it's everywhere. It's good that you, the researcher, is looking into this topic because we need to take action and stop pretending nothing is happening. So I think it is now time for the private sector to also start talking. Stop pretending. that it's not happening, and understand that SEAH is happening in our organizations too. It's not just in these large NGOs, it's not just in the UN, it is also happening in our organizations. And we need to start tackling it by joining forces with other aid actors to prevent sexual exploitation, abuse, and harassment. So thank you again for having me today, and I look forward to working together through the Safeguarding Leads Network to tackle SEAH.
Thank you, Abida. Thank you for highlighting the fact that contributing to data is really to be part of the solution, and also to show the commitment from the private sector that we are all willing to address SEAH. So thank you very much for that. Now I would like to give the floor to Marta Agosti, who is the PSEA coordinator in Palestine. She's the last speaker of today. So Marta, I turn to you. How can, in your view, the Harmonization Reporting Scheme be useful for PSEA networks in general and PSEA coordinators? That would be the first question. And how can they ensure these networks that the report's findings are effectively translated into actionable strategies on the ground? So the floor is yours, Marta.
Thank you, Colleen, and thank you, everybody, for putting together this webinar. I think it's always nice to bring us all together and explain what we are doing. I'm gonna be fast, so we keep time for questions and answers, because I think that's what people like. So very briefly, I think this project comes right on time to answer a lot of questions that we have at the field level, where we try to set up a system, where we try to support organizations and big humanitarian operations to set up a collective system that protects the communities, because it's difficult to sometimes shift from the vision that what is my institution doing towards how are we better protecting communities, and we are getting better at the accountabilities inside each institution, but what happens at the field level sometimes bring you a different dynamic. And what this project does is it puts in a dialogue 4 elements that is extremely important. One is aid dependency. So in some context, aid dependency is huge. And it really, triggers a lot of questions with regard to what happens if I report. Will I be cut from the services? Will this organization not be here anymore? Will they stop, delivering services? And this often is a perception we don't address, when we consult with communities, if we consult with communities, which is not a very wide practice. The second thing is the operational presence. In some contexts, we are able to be on the ground. The size of our operations is somehow, old enough and established enough to have a mainstream processes within the organizations. In some emergencies, we have very particular circumstances where, emergencies do explode in a way that is very difficult to understand accountabilities. And I'm going to give you an example. So in Gaza right now, 84% of the population has been forced displaced. That means that 48% of the population has left their houses and have nothing but a bag. But it's not only that, it's also that only in the month of August, we received 18 evacuation orders. This means that people that were once in one house, they are settling somewhere else, and with the little that they have to move again because they have an evacuation order. So this is a very particular circumstance of the situation right now in Gaza that provokes and links, to the third element, that is safety. So safety at all levels in the emergency responses, safety in terms of our own safety, personal safety with regard to the conduct of hostilities, and with regard to the operational system, with regard to the availability of protection systems. All 3 layers interact, and that makes that survivors very often don't come forward, because we rarely meet or address the safety conditions on all these 3 levels. Which leads to the 4th element, that it has to do with visibility. So right now, for the past year in Gaza, we have a very strong network of focal points. So we know of the cases. And a lot of the cases, they report anonymously to the focal points and they fear coming forward. And this brings, two elements. One is the importance of having a place where these cases don't get forgotten. If we don't have such a project, like the harmonization tool, these cases are not recorded. They go nowhere. They don't have visibility. It's like they haven't happened because we are not able to draw the accountabilities. And the second part is how bringing together the coordinators and the collective system helps to really provide support to the survivors while we establish a system and we address these safety circumstances, and then we establish the accountabilities. Therefore, institutions can be held accountable, or institutions can be accountable, because I am of the idea that institutions want to get better and be accountable. So how they are able to do so. And sometimes it's not only about the institution being right or wrong or good or bad, it's also about the extremely context, operational context that we face, and how we are intertwined with a conflict, and what is meaningful for the communities and what are the daily life of the communities at the time. So this is what this reporting scheme does. It fills that void where we have visibility on a make of the cases without exposing survivors, and this is very important because also the layers that we can get into the reporting scheme, seeing what are the details, will shed light into three elements. One of them is internal accountability. Are we able to identify perpetrators or not? The second thing has to do with safe programming. Are we able to offer survivors the necessary things, or are our context, operational context, safer enough for survivors to come forward? And the third element has to do with the centrality of protection, which is something very relevant in my context. It's like collectively, how is the environment that we are creating? And this goes beyond SEAH, because SEAH might be a very important thing for us, but it might be one among the many types of violence that communities are enduring at the time. So I'm a big proponent of bringing elements that give visibility to the voices of survivors and the cases, and that does it, with the two elements that are very important and they're very difficult, because we receive requests very often, and I will stop here. Give us trends, give us numbers, and we are very reluctant to give numbers, and because they are not framed, they are not properly framed. If I say we have 15 cases in Gaza right now, what does it mean if we are not able to provide the framework and contextualize what it means? And then, it depends, one organization can take it and it's too many, one organization and it's too little, and the next organization wants more details to really understand if the 15 cases are really SEAH or not. So the number itself can be stigmatizing, or, can frame survivors. So, and the second thing is that it's extremely difficult to collect data in an ethical manner. So if, we go now and really we have a donor that said, we really want to know the prevalence on sexual violence or SEAH as extension, it will entail incredibly moral issues and ethical issues on how do we get on the field to collect that data in the current situation. So this reporting scheme gives a small window where data is also collected in a very ethical manner and is survivor-centered. So this is a little bit our experience. What we are doing to facilitate the integration into the operations here is that the standard operating procedures in Palestine will include that the program coordinator, the international coordinator can directly upload the cases that we receive to the SEAH. So we'll make it even easier for organizations to report directly into the scheme. And I will stop here. Thank you, Colin.
Thank you, Marta. Thank you for all these very interesting points. And I will just highlight two things. The Harmonized Reporting Scheme can at least feels that it it fills this void to increase accountability without exposing the victim and the survivors. And everything is about also collecting and reporting data in a very ethical manner while making sure we have a victim survivor centered approach. So thank you for flagging that. So I'm looking at the time and I see that we only have 10 minutes. I know there would be a lot of Q&A. I know that in the chat, there have been many discussions. So what I would suggest, because we won't have time, you are 300 almost participants, is just to give the floor 2 minutes to Mathilde, because there are a lot of questions about who can join the Harmonized Reporting Scheme, how should we do to join, etc. And then we'll give the floor to Peter for a few minutes closing remarks. I know it's frustrating, but a 1 hour webinar is pretty short and we can't have, unfortunately, everything we would like. So Mathilde, just a few words, just to remind what Tanya said at the beginning, we have at the moment 70 participants of the Harmonized Reporting Scheme. So it doubled within a few weeks, so that's great news. And Mathilde will explain how to join the scheme and who can do that.
Thank you so much, Colleen. Just first off to say that there's really excellent interpretations, ideas, documents shared in the chat. And we unfortunately cannot respond to everybody because you are 300, but we will take notes of all of them. One key thing that I wanted to say is that, you know, the idea and the concept of the HRS is really that of a collaborative with participant organizations, which is why we really encourage you to join, because your knowledge from all of what you've shared is so valuable. And so really being part of the HRS is being part of that, community of practice so that we can analyze that data together. Because yes, graphs are great. They're such a great starting point. But then, all of these things that you've shared, the contextual analysis is essential. And so that's, really what we want to encourage with the HRS. And that's why we have loads of learning events with our members to, take that trend and really talk about it, brainstorm, and see what it means in practice in different contexts, etc. So that's the first thing I wanted to say. There's lots of really valuable points that were shared on excellent ideas in the chat, how we can other reports that we can use to triangulate the data. Of course, a really important point on sharing back this information with communities. So we know, of course, that they are the experts when it comes to SEAH, and we know that it's also a key part of accountability, and that's, I think, where the HRS can contribute to, be a part of reducing that underreporting. So if we are transparent about what we do in response to SEAH, and of course, if we improve in our response to SEAH, we hope that that's going to encourage more survivors to come forward. So these are all things, we're at the start of the HRS. We were in a pilot a year ago. So these are all things that we're hoping to expand in the years to come. But thank you for these really excellent ideas in the chat. Now, really briefly, before I pass back to Peter, if you are interested in joining, we will share the email address to contact us at in the chat. It's seah.hrs@chsalliance.org. Please contact us. The HRS is open to any organization. It is free to join. So please email us if you want to just share ideas and brainstorm. If you want to join, that's the address where you'll get all of the information at. But again, joining is free and open to INGOs, national NGOs, private sector, anybody who's interested in joining. So we'll share that address. It's on our website. So please contact us there. Back to you, Peter, for some closing remarks.
Great. Thank you very much, Mathilde. So look, it's really hard to do justice to so many great points, such a rich discussion or presentations, and so much going on in the chat, which I've tried to follow, but probably not entirely successfully. But just like a few reflections. We all know this is such a difficult area to work in. It can feel so disheartening a lot of the time, really difficult. Cases keep happening far too often. We know that we only hear about a very small proportion, and sometimes we feel a bit kind of helpless. We want to try and stop it from happening or improve the response. So what can we do? And somebody said in the chat, so what do we do differently as a result? Well, I think actually using the scheme is a really concrete first step if you don't want to take another step to try and change things for the better. And I think that having the data as a driving force for change, as I think was said, is so important. Without the data and the evidence, it's much harder to make the arguments. We're much more reliant on anecdotes, which are much easier for skeptics and the people who frankly want to work against us to say it doesn't really happen, people make things up, and so on and so forth. So I think the data is so important to help drive the change. And one of the things I love about this tool as it's been developed, and I've not been directly involved on an ongoing basis, so I can't take any credit for it. It's many others who take the credit for this, but it's the visual side of it as well is helpful. Yes, a graph is only a graph, or a bar chart is only a bar chart, but in terms of communication and education, analysis, visibility, bringing visibility to a very difficult topic, it's so important to do this. And this scheme, the tool, gives you something which, as donors, we might end up paying for it multiple times with multiple organizations, because everyone would rightly say, I want to have a dashboard, I need to track, I need fields. This scheme is giving everybody something off the shelf that they can work with, and you can make that comparison, as Mathilde showed, between your own organization and global trends as well. And of course, it's all about context, as you said very rightly, Marta, and the context you're working in is so difficult, and you have to look at things differently. DRC, Syria, you can use the data in different ways. But I think I would just say, look, if you join the scheme, you suddenly have access to a wealth of information that you would not have, and connections to a wealth of organizations as well. So I think if you give a little, you gain a lot. I really, really believe that. So it helps generate the evidence for you to make the arguments internally for why PSEA should be resourced as well, and why leaders who are focusing on many different things should also continue to focus on this issue. It makes it much easier to make those arguments internally and externally, particularly if multiple people are making the same arguments. And that's why, as Tanya mentioned earlier, CAPSEA, one of the areas it focuses on is on monitoring what we're doing, learning what works, what doesn't. And some of the data around community-based complaints mechanisms and how well used they aren't. And there's no right answer to that. And there's been some really good comments on that in the chat. But it's important to know to what extent they, amongst other tools, are being used. So I know, as we heard as well from Andrea, I think the value add for CSOs, civil society organisations, and from Abida as well, in terms of the private sector, is huge. It's easy, it's quick. For organisations with limited capacity, you really gain a lot. And then this point of, I think, Abida, you made it about this strong signal of commitment as well. And this ability, it's a really important way to stop people pretending this isn't happening everywhere. We know it is. So let's bring it out into the open and be honest about it. So, it's about internal accountability, safer programming, protection, some of the things that you were saying, Marta, and these points about survivor-centered ethical data collection, I think, are really, really important. So, look, huge hats off, kudos to CHS Alliance and SEAH and others who've been, and everyone on the steering committee, and all 70 organisations who have taken a risk, have gone the extra mile to commit to using this already. And I really hope that others will be inspired by that. So thank you for today's event, and look forward to continuing the conversation. Thanks.
Thank you, Peter. Thanks for this closing remark. Thank you, everyone, for joining today. It was great. And thank you, obviously, for our speakers as well for today's event. It's a bye-bye from now. Please do reach out to us if need be, and take good care of yourself. Bye-bye, everyone.
Thank you. Bye. Bye, everyone.
Thank you.
Thank you.
Bye, everyone. Have a good day. Bye-bye.